Now I'll talk about another issue which is like in between orthopedics and also imaging. So they call that intravenous contrast. So intravenous contrast is just simple. You are trying to give a contrast to a patient, and you're not giving this contrast directly to the site where you want to image. You are putting this contrast into the veins. So it circulates into the veins and eventually gets to the site where you want to image. So contrasts are basically substances that when they get to a particular tissue in the body, they make it that the imaging of that tissue will be more clearer. So intravenous contrast just refers to specialized substances. They are usually injected into the vein. Okay, that's before you do all those imagings, CT scans, MRI, angiography, and they help to make the visualization of that area. It could be blood vessels, it could be organs, it could be tissues, but they make the visualization much more visible. You appreciate it more. So types of intravenous contrast, you have those iodinated contrast agents. They contain iodine, which absorb X-rays. They are using CT scans and the rest of it. We have the Gadolinium-based contrast agents. They are paramagnetic metal. They alter magnetic properties of tissues using brain MRI, spine MRI, cardiac and vascular MRI. So uses mainly for CT scans and MRI scans. Okay. Also angiography for blood vessels, because most of the times blood vessels don't really show that well on imaging. Okay. And also used for veins. Okay. So these are the risks and safety, because you are putting the contrast into the body. Okay. So the liver has to break it down, send it to the kidney for excretion. So it could actually cause issues in kidneys. Okay. Nephrogenic systemic fibrosis, contrast-induced nephropathy, and sometimes some amounts remain in the body for a longer time. Okay, so this is what we got for this.